In healthcare, the stakes for cybersecurity go beyond data. They're a matter of life and death. Given the complex web of providers and regulations, bad actors find it a very profitable gold mine. Healthcare providers must secure this data, ensuring both operational integrity and public confidence. But it's not easy. As medical technology advances, sensitive data is surging, attracting more bad actor attention than ever. And to navigate this high-risk landscape, we must tap into industry expertise and follow proven security measures. And today, we've got a powerhouse of insights for you. Our guest, Justin Collier, Chief Healthcare Advisor at Worldwide Technology, will unpack the unique cybersecurity challenges in healthcare. There's more than I realized. Modern strategies for data protection and the critical role of cyber resilience, along with emergency protocols. Lots of good stories around these things. We'll also dive into some exclusive WWT resources, from programmatic consulting to some very cool wargaming opportunities that can prep you and your team for real-world attacks. That's not easy to do, and I don't know of anyone else that could even provide that for you. So let's cut to the chase and get right to it. My name is Rob Boyd. Welcome to WWT Research. Well, Dr. Collier, welcome to WWT Research. So good to have you here. I wonder if we could start, before we dive into our topic, just give us a little bit of background on who you are, what do you do for Worldwide? Because I do think it's unique and it's interesting.
Sure. So I am blessed to be one of the physicians and chief healthcare advisors at WWT. I've been here for a little over 5 years, and I serve as our industry practice manager globally for healthcare and life sciences. Before I joined WWT, I spent quite a lot of time as an informatics professional. And for 7.5 years, I was one of the division chief medical information officers for one of the divisions of HCA, which is Hospital Corporation of America.
Sounds like an interesting career path, just in terms of really getting to see multiple sides of things. And I would imagine doing what you do for Worldwide, does that mean that you are probably in front of a lot of different sized and different customers around the world?
Yeah, it's pretty great. It's pretty great
Yeah.
for sure. Yeah. Instead of just helping one health system get better at a time, I get to help a whole lot. And I get to work across the healthcare ecosystem as well.
It's 2023. Worldwide Technology puts out quite a few different priority reports in specific areas. When it comes to healthcare and it comes to security, I'm kind of curious to start us off. Why would healthcare be something to kind of extract out of the broad ecosystem of just companies in general? Just say, what kind of things are affecting healthcare these days?
I would say they're one of the most targeted. They're either the number one or number two top targeted, and given,
Well, why is that?
Sure. It's the richness of the data.
Oh.
And much of that data is data that can't be changed. So in addition to what you would consider as identity information, there's the most intimate details about us as human beings, sometimes down to our entire genome being part of what that data set looks like. Somebody steals your credit card, it's worth a couple bucks. As soon as you notice there's a problem, you get a new credit card number. That is data with a defined shelf life that's not worth nearly as much as health records, which go from $100 to $1,000 per individual patient record, depending on the completeness of that data set. And as you can imagine, you're not really able to call up somebody and get your genome changed. Pretty immutable information.
The other side of this, I feel like healthcare delivery organizations, as you kind of coached me in our preparation for this, to make sure as a way to kind of refer to, well, not just hospitals, not just doctors' offices, the ecosystem, if you will, that encompasses it. But it's that ecosystem that also seems like it makes it more complex to secure. How do you describe the challenges that administrators are looking at when it comes to securing their systems? Why is it more difficult for them to prevent those attacks? Why is that?
I would say there are probably three main reasons, or three main areas of vulnerability that really impact healthcare a little bit disproportionately compared to other industries. One is the sheer number of connections. As a healthcare ecosystem, you have a level of interconnectedness with partners, with potentially vendors, with other businesses that you may be in cooperative agreements with other health systems, other parts of the healthcare ecosystem, your payers, your insurance companies, things like that. So there is a degree of interconnectedness really that's unrivaled for any other industry. The second area of vulnerability, I would say, is the proliferation of connected things. Your IoT devices, connected medical devices, other things like that. So you have that entire ecosystem of things that it takes to take care of a patient, most of which these days are internet connected. So you just have more overall things to secure, and some of which are regulated medical devices that may be a little bit more difficult to keep those up to date. Any environment these days, that can be a daunting task just to have visibility into all of those things. What are the things that are on the network and have that connection to your enterprise, to your organization? And the third thing is the same as most other organizations, but with some nuances, and that's the people component. You have people frequently being blamed as the weak link in the chain for any organization's cybersecurity program. In healthcare, it's a little nuanced, right? You have all of the standard cybersecurity hygiene needs that any organization would have. You have a huge number of employees and a variety of different levels of sophistication, different levels of work within the organization. Some are clinical, some are non-clinical, some are business, some are IT. All of those folks are, potentially going to fall prey to a phishing attack. So that is certainly a possibility. But more challenging than that is you also have a lot of ebb and flow in and out of contract employees or contract labor. With the nursing shortages that we've seen over the past 5 years, particularly, there's been a lot more contract labor involved. You're a traveling nurse or you're a locum tenens physician, those temporary folks that may spend some time within the organization and may or may not be back. But sometimes it's difficult to know if and when they might be coming back. And so managing those directories, turning on and off those credentials can be a real challenge. And of course, if you're paying a lot for a contract employee and they can't get the work done because they don't have credentials, that's kind of a frustration. You're losing money at that point, right? And so managing through that can be a unique challenge in healthcare that perhaps doesn't exist in many other industries.
Yeah. And what I hear you saying is, and not that any even normal corporate, carpeted hallway environment, whatever we call that, with a typical thought, full of people just working on computers, that is difficult alone to secure. But in general, it's easier in the sense that there's not as many dynamics as what I hear you calling out. There's so much movement back and forth with people and real critical needs to have access. And I would think, going back to your number two, you talk about the things that are on there. And I think about medical devices.
Sure.
A lot of these have embedded systems that aren't always updatable, or maybe historically haven't been, depending on the age of them. But they need network access. But you can't. So you have to let them on, but you need to let them on securely in the same way that you need those contractors in and out. What kind of things are you seeing successful organizations do to deal with this?
The attacks are increasing. And as you imagine, a health system that has to take care of patients, that's life critical. These attacks, when they do happen, are threat to life crimes. And thankfully the FBI and the government are recognizing that and beginning to treat those criminals in that way, that these are all threats to life crimes. But as you can imagine, if you have an institution that suddenly is the victim of ransomware, they might be more inclined to try to pay to get their data back and to try to get back online so that they can simply take care of those patients who are in vital need.
Which is something the FBI says don't do, correct? They say
Right.
don't do this.
So
at the same time, you're under pressure, people screaming at you, people dying.
It's a challenge.
That's not easy.
Challenge. Yeah. And the more rural the environment, the more that's a big concern, because you might be moving patients from that location to somewhere far distant, or diverting ambulances to a much further away location to get emergency care. What are some of those best practices that we see? Certainly it's not a destination, but it's an important journey. And that's that zero trust journey. That movement toward zero trust no device, trust no person, trust no thing, trust no traffic, trust no outside data. All of those are key things. There's not a vendor solution that checks that box. It's bringing together the right processes, the right people, the right technologies, into a more holistic approach toward your cybersecurity environment. Using the right tools to gain visibility into all of the things on the network. We discussed that as being a major vulnerability for a lot of organizations. Getting that visibility, having good security around those devices is paramount. Certainly not necessarily a single approach, but bringing the right solutions to bear to gain that visibility, to understand what policies may be in place, what firmware may be in place, all of those types of things. Getting that visibility into even some of the subcomponents that may be within those devices. We saw the Log4j challenges that hit not too long ago, but just having the visibility into what are the components that make a device tick. What are those software components? What are those subcomponents? Having that visibility is vitally important. So not only what is on your network, but what's within the thing that makes it tick, having that understanding, and then being able to provide the security, the policy enforcement, and the traffic monitoring for all of those things. So that if something is not acting properly, or if it's suddenly sending data to a country that ends in Stan or ends in Usha or ends in Ina, you might be looking at some serious things that should tip red flags there. So having that, all of those levels of visibility is key.
Let me pause you there.
Sure.
Just on the visibility, because two things it makes me think of, and I just want to confirm, we've talked about visibility on this show before. It seems like one of the most concrete things to do when you establish that type of thing, you have to know, of course, what to look for and understand as much as what you're seeing to know what you may not be seeing. And that means understanding even the visibility tool sets themselves. But it's establishing a baseline so that you can recognize that there's some kind of changes. And you hinted at segmentation. I don't know if that's where you're kind of going next as part of the solution. But yeah,
Absolutely.
tell what's important to understand on that one, because it's an age-old one that sometimes people groan when they hear.
It is a crucial mechanism to be able to secure those things that are tough to secure. Segmentation to keep walls around those things that are otherwise really tough to secure. But the more important thing is when you have infiltration, you want to be able to prevent rapid spread. Not a lot different from the human immune system, right? You don't want the infection to go places. You don't want the cancer to metastasize. You want to be able to contain that and be able to address it while it's in a contained state before it spreads and becomes more dangerous. And you can do that, thankfully, in ways that we can't do with the human body with segmentation and microsegmentation. It's being able to provide that least necessary access for everything that's happening, for every person that's operating within that IT environment, for every device that's operating within the IT environment.
They're allowed to play in their sandbox, and they're not allowed to break out of that without at least going through some type of inspection process or some formal handoff that's visible and specifically allowed. But then you also mentioned the people, and that gets into kind of what you mentioned as that third challenge facing healthcare is the dynamics of the people coming in and out. And that's, I guess, identity and access management is kind of what you're referring to there. How is it not happening still? It's not easy, I guess.
The complexity of having somebody who's working this week that may take a couple of weeks off, but may be back. It's having that vendor that may come in infrequently, but when they come in, they need to be able to do their job to keep, let's say, an MRI machine running effectively or appropriately to do the job that they have to do that is to the benefit of the health system. You've got your traveling nurse that may be here this month. They may not be back for 6 months, but when they come back, you want them to be able to start work right away and not have a delay while you're reprovisioning them. But there are times when they become zombie credentials. Being able to effectively manage that authentication environment, those credentials, all those things, it's a daunting task without the right tools, for that matter, without the right visibility. How long has it been since credential A was used? What was it used for? What is it supposed to do? We do see more and more organizations moving to more aggressively police that environment. But it's daunting when you've got thousands and thousands, tens of thousands of individuals and credentials that are out there.
Well, and to make sure everybody understands that's watching this, is it really what that social engineering, that bad actor is doing, no matter the method, is they're looking to leverage the credentials of the person they're speaking with to get access. And so that's one other reason. So sometimes I think I've seen customers get concerned. I don't want to think Patty or Bob is a bad person. It's really not about that.
And that to some degree leads us to the next best practice, and that's automation potentially and AI. Humans can only see and pay attention to so many things at once. Computers are far less limited in terms of their ability to be aware when something happens and to have perhaps broad awareness when something happens, to be able to monitor in real time many, many things versus the number of things that humans can pay attention to. Deploying those types of mechanisms so that you can see when Patty's on PTO, but Patty has activity on this. Is that good, bad, and different? And not only that, but to start to take action, being able to monitor policies and firmware on devices in an automated way, being able to push out policies in an automated way, being able to detect traffic that's going to a blacklisted country in an automated way and shut it down.
The one other thing I just kind of want to ask about is the ability to restore from backup or have a disaster recovery plan. What type of things are you seeing in disaster recovery in this space?
So we've been talking about defense up until this point, best practices for prevention. cyber resilience really comes into that response after, an infection has happened, after something bad has happened in your environment. And more these days, it's not a question of if, but when. And, that's something everybody says all the time, right? So it's
Still true though.
still
Yeah.
true, remarkably true more and more every day. Whether you're the biggest of the big or one of the small but mighty health systems that are out there, chances are at some point you're guaranteed to have attacks. You might or might not fall to those attacks. But if you do fall to those attacks, how quickly can you recover from them? How quickly can you get operations back up that are critical to saving patient lives? How quickly can you get operations back up that are critical to your business continuity, ability to continue to operate, especially in these tight financial times for health systems? Those operations are also keeping the health of the health system. If that makes sense, it's keeping the blood pumping throughout the organism, keeping it healthy and viable. If you look at most health systems that have big cyber breaches, it takes them at least 30 days to get to anything that's close to a semblance of business as usual. And that's a long time. They may be able to take care of patients more quickly than that, but the faster you can get back to using your tools, back to using your data, back to being able to take care of patients in an optimal way and to operate your business, sometimes determines a lot about your future health as an organization. And we have seen health systems that have actually gone bankrupt and gone out of business because of cyber attacks in the past year. Several of them have been in the headlines just in the past couple of months. Mm-hmm. No organization wants to go through that. And the patients depend on those health systems for their care, for their health, for their wellness in the long term. And so it's in no one's best interest for that to happen. If an attack does happen, it's in everyone's best interest to get that organization back up and running again as quickly as possible. And so those resilience and recovery strategies are really key to that. No one size fits all.
Well, I was just going to comment on that one because and this is something I've learned from WWT and working with some of because you guys have specialists in backup recovery, cyber resilience. What comes up first and what has to come up first? And how do you, and even to the communication plans, to how do you communicate this internally and externally? You're probably not going to get there very quickly, and you could create more issues than you even started with in that situation.
And you need the right environment to bring those things back to life, right? To rehydrate your system, so to speak. So recovering in the right way is multifaceted, and coming up with the right strategy for your organization is absolutely crucial. Definitely not something that any organization, in my opinion, should undertake without strong partners to help.
And you've got to imagine it's going to happen beforehand. This is not something to be addressing. I mean, it's going to happen to some people, but ideally you have to imagine this. And this is where the second part of my question you were going to comment on, I think, is just the notion of testing your ability to execute on the plans you have.
Some organizations better than others. We see, red team, blue team events. We see pen testing happening. We see all of those kinds of things happening in environments to try to test them out and to try to test the people themselves and their ability to respond, their ability to address those challenges. All that's super, super important. But another aspect of it too is making sure that all your people are trained on all of the tools, especially as you're deploying new tools to do some of the things that we talked about today. And that all of your people have sort of the mindset of what a real attack can look like.
Yeah.
And that can be really difficult to simulate. And that's where things like our cyber range within our Advanced Technology Center here at WWT can really help out.
I'm so glad you brought this up because I had not experienced that one before, and it sounds very interesting and very valuable. Do you mind explaining what that is?
Like everything in our ATC, it grew out of what our customers tell us that they need. Big banks had a need to be able to test their people, their systems, potentially future systems that they might choose to deploy to secure their environment. They need to be able to test that with live fire. What does a real event look like? How do they defend against it? How do they use all of the tools when they're in a crunch situation, not when they're in the day-to-day keep the lights on situation. And so the cyber range was developed to address that need. So you've got, network data center, things that look remarkably like a live organization, some synthetic data in there that a bad actor or malware might try to steal or encrypt.
And you guys really, you approach it, as I understand, from a gamified kind of perspective. So you actually make it a fun interaction because it takes several days normally?
It's somewhere between 15 and 20 hours of game time or action time, if you will. And usually we give teams up to 72 hours to complete the scenarios that are in front of them. teams are competing against other teams. They can see how they measure up. They can see how they stack up. They can get a sense of performance that way, but it's in a fun way. Have not to date had anybody say that it wasn't a blast, an absolute blast, and something that they would want to do again. In the past couple of months, had a dedicated healthcare blue team event. So all the teams that were competing were all competing on their ability to defend, to monitor, manage, contain, defend, and recover from an event that had a lot of different stages. And
Wow.
it was pretty exciting to see the level of engagement. And in fact, some of them liked to quibble about who got that last point. There was a tie at the end. And so the tiebreaker became highly controversial.
We are very competitive,
but,
even if we don't show it.
But a fantastic experience for all of them.
It becomes memorable at that point, right? And you're building them new muscles to be more comfortable in that. So it's not, new. It's deja vu, as I've heard someone say before. But
great team building for every team that participates. We hear that a lot. Great training on tools that they might have been less familiar with before the event, tools that they might be evaluating for deployment within their environment.
Very
and real world scenarios. Pretty fantastic. Now, that's not to say that tabletop exercises are dead or don't have a role to play.
Yeah.
They continue to be absolutely critical, but they're critical for different things and different aspects of how you would respond to an environment. It's more thinking through the people and processes side rather than the action side of what you do if something bad happens. So it's things like who do you notify, how and when do you notify your board if something has happened. Those types of things still, you want to have a tabletop exercise for those. Yeah. You want to have that kind of disaster preparedness sandbox and work through it on an annual basis. And it probably should involve more than just cybersecurity. At most organizations, it probably is limited to cybersecurity and IT. More and more C-suites and boards are on the hook.
Yeah.
And they are expected to be aware of what's being done to defend the environment, aware of what happens when something bad happens, and part of the solution when something bad happens.
Yeah.
So having those parties engaged, in the case of healthcare, having health systems engaged, their clinicians, bring those clinicians to the table to understand how their workflows are going to be impacted and to really practice those downtime procedures. No health system really practices downtime procedures for if their EHR is off. They say they do, but it's that 1 or 2 hour downtime that happens in the wee hours of the morning on a Sunday when an upgrade is occurring. The reality is everything just hits pause and they wait for the system to come back up because they know it's coming back up. They write notes to themselves on napkins or on shrub legs or things like that to then put into the computer when the computer comes back on. That's not practicing downtime.
Yeah.
That's not how you really would care for a patient if your systems were deader than a doornail.
Yeah. But there's got to be procedures and policies in place to say this is what you should be doing. And then that's got to be trained and reinforced and tested.
Yeah. And the vast majority of nurses and physicians that are out there, that group that is the majority is quickly becoming a group that never has been trained and has zero experience operating in a paper environment.
Yeah.
They've only ever experienced the electronic tools working as intended and their ability to handle that without practice.
When you talk about the threats and the nature of the environment with people coming and going, you're like, well, wait, how do I even begin to have a standardized training curriculum or expectation with people who don't directly work for me? They're contractors and partners, which you can put controls around. You've just got to have a way to enforce it and find that balance of not being too onerous, but certainly knowing that, hey, we take this seriously. And if you're going to work with us, this is how you have to play. Worldwide technology obviously does a lot of different things to help someone at whatever degree they're at. No shame involved with saying, I honestly want to learn. What do I do here? Here's how we do things. And you guys have methodologies and processes for walking organizations through that. And I would assume because of your influence, with a respect for the fact that this is a business that isn't stopping down to go do some training, and then come back. And so you're used to working in that environment that could do that.
Final thing that I'll leave the group with, and this is both a challenge, but also a way that WWT can potentially help. And that's staffing for cybersecurity is a major challenge globally, regardless of industry.
There's not enough people.
Right. But other industries are very good at poaching healthcare workers. Unfortunately, in the cybersecurity space, some of them frankly pay much better. And so healthcare has a real challenge with having enough of the right people. Our team can help with that in a variety of different ways, whether it's helping you get those tools that can help automate the mundane or automate the things that can be, so that your smart people can focus on the things that only they can focus on, letting them practice at the top of the license, if you will, or at the top of their degree, helping the health system in that way. We do strategic resourcing as well for even very hard to get cybersecurity talent, folks that are vetted as if we were hiring them ourselves to do the job internally for WWT, and all of those folks having also reached back within the WWT organization to phone a friend, so to speak, another way that we can help. And of course, our consultancies, they're globally well known throughout many, many industries as being able to help plan with strategy, help plan with tactics, help plan for recovery efforts, all of those types of things that organizations might want to have. And that's something that in many cases we can even make available in small increments without any cost to the customer. Our field CISOs, they provide hour of cyber consultations on particular topics that are of interest to customer executives all the time. Where they'll spend an hour going through a particular discussion, perhaps what's the latest and greatest with segmentation, microsegmentation, what's the state of the industry, what's the state of the cybersecurity world when it comes to those types of things. And of course, our ATC, everybody needs training, and the environment is changing constantly. The number of tools, the types of tools, all of those things are changing constantly. There's a tremendous amount of education and training material that's available free of cost to anybody with a login. They just have to sign up with the email address that they go to work with. And they have access to those types of tools.
What's important here is developing a culture, an attitude of we can't be, we can never be secure enough. It's going to take an effort to do it, but you have to start somewhere, but there's help available. And there's, and not mention just on how to do it, but also how to not do the wrong thing and waste money in the wrong directions, potentially chasing after tools or falling under the spell of very persuasive vendors.
Yeah, absolutely. And then thankfully, we have an entire army of people who are much more expert than I am when it comes to cybersecurity. I'm just the doctor on the team.
I think you've done enough education. Let's divide up the load a bit, shall we? Because I think that's how we're all going to survive. Dr. Collier, I appreciate your time and thank you for joining us and sharing.
My pleasure. My pleasure. Thanks very much.
Great information, all admittedly touching on very broad yet important information that's worth exploring. So I encourage you to be sure and check out the latest WWT research on this topic with best practices for healthcare delivery organizations to safeguard sensitive data. This information was just released and it features a lot more detail along with helpful information and guides for where to get more information and where to take next steps and really see how WWT can provide assistance for you so that you're not wasting time or money in that direction. My name is Rob Boyd again. Thank you so much for joining us. We'll see you on the next one.